Oh, and we have to explain that you cannot say the D word.
Dog.
Okay, that's one drink for me. Thank you.
Okay.
So that is the rule.
You own
Okay.
the
If you
drink.
say the D word, you buy us a drink.
Yeah.
Okay.
So yesterday.
1-0. Thank you.
Yes, yesterday.
That one doesn't
We
count.
got a whole bottle out of one speaker yesterday.
Okay.
Sorry for saying Sorry Media presents the Purr Podcast, the best podcast for feline medicine and surgery with tips, tricks, and updates for the entire veterinary healthcare team. If you're dying to know more about cats, keep on listening. Here are your hosts, Dr. Susan Little, famous cat vet and textbook author, and Dr. Yola Kerpenstein, talented surgeon and social media geek.
Hello, this is Dr. Yola Kerpenstein and
Dr. Susan Little.
we are so excited here, but we have to hurry a little bit because the next speaker that we have right here is speaking about 30 minutes.
Yeah.
And she told me that she had to be nervous before
Yeah.
our lecture. So
Yeah.
we
You
better
have to
get
build
started.
in time. So, we'll and we're just lucky to get her.
Mhm.
We're lucky to get her.
I know.
Yeah, so we're still in New York.
We're in New York right now.
Yeah.
Hello, New York.
Yeah. And what do we
I
like
love
about
it
New
here.
York.
What do we like about New York?
Oysters.
Oysters. And what else do we like about New York?
Oh, I don't think that our guest likes oysters.
No.
No. Anyone that knows me knows I don't like oysters. But let's stop talking about food.
Yeah.
Or Dr. Little is going to take us on a different adventure.
Yeah.
I'm
Kara
right.
and I have a colorful history talking about food, so we'll
Let's
spare her.
introduce Kara first
Yeah.
before we start talking about
Yeah.
food.
Tell us a little bit about yourself, Kara.
Hi, everyone. I'm Kara Burns. I'm a licensed vet tech, a vet tech specialist in nutrition. It's a group that I founded and am the president of because I am so passionate about nutrition for animals. And currently I'm the president of NAFTA. I speak all over, just do lots of things because I believe in nutrition and the profession so much.
Yeah.
And so thank you for
And you're
Oh.
for
awesome.
having me.
And
You're
you're awesome.
our first vet nurse.
I know,
Yay!
first
Yay!
vet nurse ever
Hopefully
in
number
the
four.
podcast. So
Yeah.
we started the podcast in June, so about a couple of months ago.
Yeah.
Okay.
And I can't believe it took us so long to
I-
get
yeah.
a vet
We
nurse.
had to wait for the best.
Oh, yeah.
It takes
the
time.
top of the top.
It
Yeah.
takes time to get
I
the
know.
top one.
Truly, I called them on it, everyone. So.
Yeah. So you mentioned specialty.
Mm-hmm.
So it's fairly recently that vet nurses or vet techs can have a specialty, though? No? Or
No,
tell
actually,
me about this.
yeah, the very first specialty was emergency and critical care, and that started 22 years ago now.
Oh,
Wow.
I did not know that.
Yeah, that was the very first one, and as of today, there are 16 veterinary technician specialties that have been recognized by NAFTA.
That
So
is
I
cool.
have a question for you then.
Mm-hmm.
So is there a specialty nurse, how do you call it, position for cats only?
There
Ooh.
is a veterinary technician specialty for feline patients, and it is in it. Yep, it's
actually
under
did
the.
not know that.
It's under the vet tech specialty in clinical practice.
Yeah.
They have canine feline. They have
That's one.
No.
that one. I don't think that one can
no.
count.
No,
Oh.
it doesn't count. No. So
Um,
we're making sure that Kara doesn't say the D word. So
No,
pretty
yeah.
good.
Okay.
Well done,
Okay,
Kara.
so
Yeah.
so
Good job.
that one.
Yeah.
Um,
It could be
exotics.
tooth, canine
Yeah.
tooth, canine tooth, that's it.
Okay. Yeah.
Yeah.
There's also one under clinical practice for exotics, and then just recently feline
Ah.
specific.
That is awesome.
So yeah,
That's
yay.
awesome. So how many people have graduated
Yeah,
already?
for feline. How many are
For
in feline?
And where
It is-
where can we hire them?
I'm sure they would love a shout out to their website, the Academy of Veterinary Technicians in Clinical Practice.
Okay.
And so if you go to that website or go to the NAFTA website, you'll see a link to there, and they can tell you all you would ever want to
Oh,
know
that's awesome.
about feline technician specialists.
We'll
So-
put a link on the
Yeah.
podcast website
Absolutely.
on our
Yep.
Per podcast website for this episode. We'll put the links to
Awesome.
like NAVTA and the specialties. Yeah.
Yeah,
Okay.
that's
We'll make
and
sure
and
it's
the
there.
nutrition
And
specialty.
of course.
Of course. What
Of
else?
course.
What else?
That'll be
you
the
know?
first one.
Yeah,
Yes.
there There
yeah.
we go.
Exactly.
Yeah.
First link.
Yeah.
You know.
But yeah, no.
That's very cool.
Technicians and nurses, we love our
They
cats.
Yeah.
Yeah.
They rock. They rock.
Yeah.
So and just to, because you have a lot of clinical practice too, what is different with cats than with the other species?
Yeah, from the nurse's point of view.
From a nurse's perspective.
Yeah.
Wow.
They scratch.
They do scratch. Some bite. No, I'm kidding. There are so many. That would take up the whole podcast. But we can look at the physiology, looking at nutrition.
Yeah.
We can look at the special needs really to make their life easier and less stressful, either at home or in the clinic or
Yeah.
getting to the clinic.
Yeah.
So there's
As a nursing patient, like, so if you have an in-hospital patient,
Yeah.
so how are cats different from your point of view? I mean, I can always say from the vet's point of view, but from the nurse's point of view, how is a feline in-hospital patient? What do you think of for them that might be different from another species?
Okay. I was trying to get her to say it.
Yeah. Good
Well
try.
done,
Good
good
try.
try.
Yeah, almost there.
Hey, nobody's
Yeah.
ever tried to trick me before. We got to be careful. This one's sharp. Okay.
I know.
Yeah.
Well, I think from a nursing standpoint, there are so many things that differ from other species.
Yeah. They get stressed easily.
They do,
Yeah.
and that's that's a huge part of it.
Yeah.
I think the nursing team really has to look at where the patient is, where that cat is in the hospital.
Yeah.
How they're being treated. We can't have other species around that are stressing them. We can't, and I'm always going to default to nutrition, but we have to be cognizant of their ins and outs. What are they eating?
Yeah.
Are they eating
Are they
while
eating?
they're in the hospital?
So many just don't even eat.
Exactly.
Yeah.
And what could be, in addition to the reason that they're hospitalized, what else could be contributing to that nutritional factor that is causing the cats to not want to eat. It's also easy, very easy, for the team as a whole to cause, if you will, a food aversion.
Yeah.
And that's the last thing that
Let's
we
talk
need
about that. Yeah.
in cats.
So one of the things that I often talk about is if you're going to change a cat's food, you have to think of the timing,
Yes.
carefully.
Absolutely.
Right. So what do you think if I have a patient, let's say, I don't know, it's in a kidney crisis, right? So he's in the hospital and he needs to be on IV fluids, and I want him to eat a renal diet. When do I introduce a renal diet for that cat?
Excellent question. Not while they're hospitalized.
Yeah, I'm glad you said that because that's what I think.
Yeah.
Yeah.
And so many of us, in practice think, oh no, that's the right thing to feed them. We have to start it right away. But truly, the stress of the cat being in the hospital, first of all, they don't feel well.
Yeah.
They're away from their home and their person, and now they're in the hospital surrounded by, all these unknowns. If we truly do put in a therapeutic diet aimed at helping whatever they're hospitalized for, we're just they're gonna associate that with all
fear,
that
right?
stress.
The pain,
Yeah,
everything, yeah.
yeah.
That's what I think.
And so no, the only time you'll probably hear me say it is in these instances. Feed whatever they will eat. They have to eat, and then let's work with the owners when they get home to truly get them on the diet that will help them, the nutritional management that will help them long term.
And aren't you a little worried about compliance then with the owners? Because
Yes.
when the owner they feel even worse when the cat is not eating.
Yeah.
So
Right.
they will probably fall back to the old diet that the cat likes.
Yeah.
Yeah.
And which is most of the time not the diet that we should feed them.
Right.
So how do you deal with that then?
Well, all of these questions are wonderful because these fall to the nurses. We should be the ones doing this. We should be talking to owners about the veterinarian's recommendation, making sure they understand it, and because with understanding comes acceptance, with acceptance comes compliance. So,
I like that.
So absolutely, turn it over to your nurses and let them, to your veterinary nurses, and let them do the education and the follow-up. the worst thing we can do is to just send a client home and say, okay, good luck. We need to be following up to see, are they eating? How are they doing with the medication? Does everyone in the family understand the recommendation and the treatment plan? So,
yeah, I often say, if things aren't going well, let's say it's a food that really matters that you don't like, let's say a urinary prevention, like a stone prevention diet, right? Then you don't want a lot of other treats or foods. Check if there's a grandmother in the house.
Absolutely.
Yeah, they're
Absolutely.
the ones. I mean, I don't want to malign grandmothers everywhere, but it'll be that one person in the house who's not on board.
Right. And that goes back to, and again, people who know me know I say every pet, every time. And what that means is every pet that comes in, we have to do a nutritional recommendation or nutritional assessment, and then with your veterinarian make that nutritional recommendation. And with the nutritional assessment comes the question of who else is in the household, because we do have to educate the entire family.
This episode is made possible by the generous sponsorship of the Take the Pledge Against Struvites in Pets Facebook page. Did you know there are 3 easy steps to treat bladder stones in cats with lower urinary tract signs? Step 1 is to take a radiograph, and if there is a stone present in the bladder, step 2 is to use the Minnesota Urolith app for iPhone and Android to determine the most likely type of stone. Step 3 is to treat the cat for at least 2 to 3 weeks with an appropriate diet and see if the stone gets smaller. If so, keep feeding that diet until the stone is completely gone on follow-up radiographs. If not, check compliance with the owner and look for alternative treatment options. Join veterinarians worldwide to take the pledge not to remove struvite stones by surgery anymore.
Yeah. What are your favorite tools for nutritional assessments? So I'm thinking, for example, we use a lot of the WSAVA tools.
Yes.
Right?
Yep.
So tell me what ones you like to use.
Well, I think the WSAVA tools are incredible.
Yeah.
What I like of those are the body condition score, the muscle condition score. There's also, how do I recommend a pet food?
Yeah.
And I get that question all the time. And Wasava has a wonderful tool on their website that helps you walk through that and have a better understanding of some of the things that can help the veterinary team make that recommendation.
Yeah, I think we're often not comfortable ourselves, are we?
Exactly.
We have to be comfortable ourselves,
Exactly.
right, before we can work with clients. And there's a diet history form in that toolkit.
Diet history form, there's a short form, there's a long form. And these are tools that we should be using every single day on every patient.
Yep. Yeah.
So,
I think there's even like a caloric intake calculators and sheets. It's really a rich toolkit, isn't it?
It truly
free.
is.
And it's free.
It's free.
Yeah.
What more could we want?
I know. WSAVA.org. We'll make sure the link again is on our page.
Yeah. And the Pet Nutrition Alliance
there's another
also
one.
has a calculator.
Yeah.
And I know the Pet Nutrition Alliance and the Wasava Global Nutrition Committee work together.
Yeah.
So check out both of those resources.
PetNutritionAlliance.org, I think.
Yes.
Right? Yeah. We'll make sure the links are there. Yes. Yeah. Thank you for mentioning them because I did work with them at one time, and it's an amazing group.
Yeah.
It's an amazing group of experts.
Yeah.
And there's, for both groups, I think there is nurses, technicians involved.
Absolutely.
In their boards.
Absolutely.
So to, when they all are in a big cloud up there, you pull them down and say, hey, make it practical, make it useful for us.
Yeah.
And we need that first line approach from technicians. I think technicians and nurses often relate to clients better when they're talking about like daily things like feeding their pet and their pet doesn't like food, right? I often think nurses just do a better job. People relate better.
Yeah, and I think that really is the nurse's job. You both as veterinarians should be doing the things that only you as veterinarians can do, and we should be doing the other things. Communicating and educating clients is a huge part of that.
Yeah.
I love that.
Yeah. So I'm going to ask you, what are your favorite tips to get cats to eat? Not to change foods, but we're trying to coax a cat to eat or get. So it could be drugs, it could be tips. What do you like to do? Let's talk about.
One of the most simple ones, and every time I talk about it, I surprise myself, and because I think, why didn't I ever think of that? Cats hate their whiskers touched, right?
You're so right.
And
they're sensitive.
Yeah, they're very sensitive. And so someone said, well, just use a flat dish. And I'm like,
Brilliant.
Why didn't I think
Brilliant.
of that?
Yeah.
We really need to look at the cat in its environment, and so use a flat dish if we're trying to. I mean, we can always do the transition of, start with 25% of the new, 75% of the old, and take a week, take a month, whatever. Yeah, whatever works.
It's usually not an emergency to change a diet.
No,
right?
No.
I think that's a good way to think about it.
Yeah,
You've got time.
Exactly, especially if it's that important to have a cat on the diet long term. Then let's take the time to get them there. But again, what comes with that is follow-up. Because how often have we made that recommendation? We'll follow up with them maybe once. But then a couple of months or maybe even a year down the road, they come back and they're not
back on grocery store food because the cat will eat it.
Thing.
So
we're back to the compliance thing. Yeah.
And a big part of getting cats transition for me is education of the owner. So I think education, look at the flat dish thing. And this, you can feed side by side. Try a different kibble shape, or there's so many things that I don't think our colleagues think about. And I know how busy it is in practice. But we owe it to that patient to really spend the time with that owner.
Warming up the food.
What's that?
Yes, warming up the food.
Warming up the food. I often find if it's a multi-cat household and you've got, like, say, one older sick cat, sometimes he just needs to eat alone, right?
Absolutely.
Other young cats will push him off his food. All those things need to be investigated.
Absolutely. So if you have, if you have a chubby cat, you can feed the other cats, get a box, cut a hole in it that the big cat can't get through. I mean, to me, these are simple, but they're genius.
They're genius ideas.
Feeding puzzles. I mean, there are so many things.
Let's talk about feeding puzzles.
Okay.
Why do you like feeding puzzles for cats?
Because we're going back to the cat's true instincts. So they're in essence hunting. It's mental stimulation. It's getting them up. It's physical stimulation too. It's getting them up and moving, so they're not just a couch potato that's leaning over and eating and just getting bigger and bigger. I love feeding puzzles.
I think we often wait until a cat is, say, obese, for example, and then start introducing feeding. Why don't we start from the get-go? Right, prevention.
Absolutely. I think we should be doing that.
And they take to them easier when they're younger. But I've got a video I show sometimes in lectures of this old arthritic cat who needs to lose weight, and old and arthritic as she has, she'll push that food ball along by golly and get the food out of it.
Absolutely.
Right?
I think it's so easy to implement in the home, but we're not doing it as often as we should.
And the vet nurses can really help us there.
Absolutely.
And there's now multiple options also that you can get. I mean, it used to be that they were very
just a ball.
archaic. It's a ball, and if the cat doesn't like the ball, it doesn't work, it doesn't eat. But now there's so many different ways you can do it. I love that idea to really do that. It's also something that people always feel bad when, they don't have time for their cats. Often
that's
the
true.
cat really doesn't want that much time. I mean, they just want to play around.
Except my Persian.
Of course.
All he wants to spend time.
Well, but he's a Persian.
He's the best Persian.
He's the best
I'm
Persian
sure.
ever.
I've heard that before, actually.
If you see pictures, he is
I've heard there's only one Persian, really, and you own him.
Yes, that is true. That's
What's
true.
his name?
Oliver Queen.
So
it's
really
so it's Ollie.
Ollie for short, for people that know him.
Yes, like Uncle Yola.
Those were on a first
Uncle
name
Yola
basis.
That's exactly.
Well, I aspire someday.
That's right. Aunt Susan.
To be an Aunt Susan and be able to call him Ollie. But we laugh. But don't you think you do better if you own your own cat, or don't you think you can explain better if you're a pet owner yourself?
Absolutely.
Yeah.
I think you can relate with the pet owner. You know what they're going through.
You see what they see.
Exactly.
The interesting thing is you seem to attract animals that have short noses too.
I do.
Yes.
Can you tell me a little bit about the other animal without saying the D word?
Yes, I have a Frenchie who is Fribble, the best other pet ever. And
I love the name.
I love the name. Cute breed.
I know there's some controversy, but I love.
But he doesn't know there's controversy.
Exactly.
Right? Yeah.
And Fribble, she's perfect. She doesn't.
Yeah, she doesn't know there's controversy.
Yeah, and
that's awesome.
Yeah.
Cool.
She is the world's best other species than cat.
Yeah. You passed this one perfectly. I love it. So going back to we need to watch the time a little bit because I don't want you to become late. But so I always stress from a surgical standpoint, and that can be for other species, but definitely also for cats during surgery, is that we do not use our technicians and nurses good enough in surgery.
Oh, you mean as surgical assistants? Oh, that's a really good point.
Yeah, absolutely. There's a vet tech specialty for surgery technicians as well, and we've had some sessions here given by the vet tech specialists in really cool. Surgery. Yeah. Wonderful. So yeah, absolutely. Whatever you are specializing in, please utilize your nurses. Because one, we want to do that. Two, it will help with morale. It will help the profession overall.
With efficiency.
And it's really in the best interest of the pet.
I think the pet gets better care, right?
Yeah.
So, it's a more qualified team.
So I know that both of you do utilize your nurses and technicians.
I cannot practice my nurses. I would be lost, more than lost.
And thank you, because
more
that's...
Lost.
And I just want to say, so if you go to a human OR, which is a species that we can talk about, and you look at what the surgeon does itself, and then his surrounding staff that helps him in the OR. It's just unbelievable. And then we as veterinarians feel, oh, that's all not necessary. I'll do everything myself. And I think that is so stupid.
Yeah, I agree. I think it is a team. We should have a team approach, whether it's surgery, whether it's nutrition, whether it's dentistry, it doesn't matter, but it should be a team approach. General practice, please utilize your technicians. Actually, career opportunities is what I'm getting ready to talk about. And we as veterinary nurses and technicians want to be utilized. We want to see what else is out there for us. We went to school to have our credentials and our knowledge and our licenses used. So please utilize us.
And this is why we love you.
Yeah.
So you do an awesome
and it's
job.
that passion that we love. Thank you.
And I don't want to cut you short, but I mean, I know you have a lecture in
I
about
do.
10 minutes, so you need to run there.
Let you go.
Thank you so much for
Thank
joining
you.
us.
Thanks for spending time with us.
Being the
This
first
was
vet
awesome.
nurse
Yay.
on our podcast. I love it. Thank you.
Thank you.
So much.
Thanks,
Thank
Kara.
you both.
All right. Thanks.
The opinions of this podcast are those by Dr. Susan Little and Dr. Yola Kerpenstein. Veterinary medicine is a complex profession, and often there are multiple diagnostic and therapeutic options for different disease processes. If you're a pet owner with questions, please go to your local veterinarian. If you're a veterinary professional, ask your questions on our Instagram page @PerPodcast. Dr. Susan Little is a feline medicine specialist with 2 cat-only hospitals in Ottawa, Canada. She is best known as an international speaker and as the author and editor of 2 textbooks, The Cat, Clinical Medicine and Management, and August, Consultations in Feline Internal Medicine. Along with 3 cats, she also admits to owning 2 dogs, and you can follow her on social media with the handle @CatVetSusan. Dr. Yola Kerpenstein is a diplomate of the American and European College of Veterinary Surgeons and a big cat fan. His specialties range from surgical oncology and reconstruction to minimally invasive surgery. He is the author of 2 textbooks on basic and reconstructive surgery. Did you know he was allergic to cats? Yola works currently at Hill's Pet Nutrition. You can follow him on social media with the handle @GVETSX.